Hello, today we have the great pleasure of interviewing Dr. Lax Bhatt, the CEO, founder, and president of Reviva Pharmaceuticals. Dr. Bhatt, great to have you here.
Thanks for having me here.
Dr. Bhatt, Reviva recently announced the completion of enrollment for its phase 3 trial in schizophrenia. What can you tell us about this trial?
So we are developing brilaroxazine for the treatment of schizophrenia. We believe the brilaroxazine can address significant unmet need in the current standard of care. We are expecting the top-line data next month in October. So we completed phase 3 study, the enrollment of 410 patients. That is around double the patient population compared to previously completed phase 2 study. So in the phase 2 study, the brilaroxazine demonstrated robust efficacy for major symptom domains and also has shown a very clean side effect profile. We believe in the phase 3 study, the drug will either give the similar or even better results compared to what we already generated. So that's our expectation from the phase 3 data readout.
Dr. Bhatt, that is just amazing news. And again, for our viewers, let's just go over a little bit. Robust data with the brilaroxazine in phase 2. I want to just go a little bit deeper. I know you mentioned it just a second ago, but let's go a little bit more deeply into the significance of these results in the phase 3 trial and what we could expect.
In the phase 2 study, the brilaroxazine has demonstrated robust efficacy for all the major symptom domains of schizophrenia. And then besides that, the safety profile was excellent. So we believe, based on the data in hand, in the phase 3 study, our data will be in the similar what we generated already in the phase 2 or even better. Especially for the safety, this is a major concern in the current treatments, available treatments. So currently available treatments are known to cause a variety of side effects, especially the metabolic side effects, cardiometabolic side effects, such as weight gain, drug-induced diabetes, as well as dyslipidemia. These are major problems. So phase 2 data, it was very encouraging. So besides these drug-induced side effects, there is another aspect of side effects that's called drug-drug interaction. Based on the current literature, it is reported that about 1/3 of the side effects associated with current standard of care derived from are associated with drug-drug interaction. So based on a recent report, over 76% patients, they take more than 5 medications besides schizophrenia medications. This is a very serious concern in the treatment of schizophrenia. We have presented the drug-drug interaction data recently in the month of May in an international conference. So our drug has shown a minimal variation or a potential of causing drug-drug interaction compared to other standard of care widely used currently in the market. So we are very encouraged by the promising data generated. We believe this could immensely benefit patient population in providing quality of life. So addressing the side effects and drug-drug interaction, it not only helps in enhancing the efficacy, but also it helps in mitigating the side effects. The end result will be improving quality of life and then better treatment outcome.
We just want to get into the unmet need now that brilaroxazine is addressing. Could we have a lot more color on that, please?
With respect to efficacy, the most approved antipsychotics have efficacy for positive symptoms. This is one of the symptom domains in the schizophrenia. However, most drugs do not have adequate efficacy for chronic conditions called negative symptoms. It's very hard to treat cognitive dysfunction. So based on the data in hand in the phase 2 study, our drug has shown robust efficacy compared to my knowledge, the other available treatments currently for schizophrenia. So again, we hope to reproduce that kind of data or even better in the phase 3. Then with respect to side effects, again, most approved antipsychotics are known to cause a variety of side effects at varying degrees, especially the weight gain is a major concern that lead to diabetes, as well as a metabolic disease, diabetes and dyslipidemia, and then obesity. in many patients in the long-term treatment, they are kind of lifelong. They have to live with this, drug-induced diseases or side effects. So our drug has shown very clean profile. That's very encouraging. And then, as I mentioned, drug-drug interaction, this is also a major concern in the treatment of schizophrenia. So our drug has shown, compared to other widely used blockbuster drugs such as Abilify, lurasidone, or Seroquel, these are all widely used antipsychotics currently in the market. They are known to have a drug-drug interaction when with certain drugs. Our drug has shown so far very clean profile in the similar trial in the drug-drug interaction that we recently presented in an international conference. So overall, this looks very promising for us. But this could be a next generation drug to treat schizophrenia with a clean side effect profile with improved efficacy.
Let's turn now to the market opportunities for brilaroxazine. Give us some color there, please.
Schizophrenia is a large indication. And again, schizophrenia often associated with other neuropsychiatric conditions. Currently in the market, there are 13 new drugs got approved over a period of 40 years. Out of that, 6 to 7 drugs became blockbuster drugs within little over 1 year of introduction to the market. So one thing is very trend if you look at these blockbuster drugs. Besides the PANSS score reduction, PANSS is a scale used for assessing the positive and negative symptoms efficacy. So besides the total PANSS score reduction, that is for an approval criteria, on the primary endpoint, those drugs also showed efficacy on the secondary endpoint for negative symptoms. Again, efficacy, the magnitude of efficacy can vary, varies from drug to drug, but one thing is common, significant efficacy for negative symptom. And then those drugs also got approved for additional neuropsychiatric conditions such as major depressive disorder and then bipolar. Our drug has shown good efficacy for the negative symptoms as well in the secondary endpoint. We believe, based on the profile of this drug, we can readily develop beyond schizophrenia to additional indications. For example, the schizophrenia current market is around $8 billion, and then it is expected by 2028 over $10 billion. And then major depressive disorder is again a huge market, over $20 billion market. Bipolar again is close to around $8 to $9 billion market. Neuropsychiatric conditions, again, with a total addressable market size of around $40 billion. So based on the profile of our drug, if the phase 3 data readout is positive, it's not very far. In the next month we will have. So we are very optimistic about the market outlook for our product.
Dr. Bhatt, you have laid out a compelling and exciting story. Can you wrap it up into an essential value proposition in just a few words? Why should an investor take an interest in Reviva Pharmaceuticals right now?
We have a significant readout in next month in October that has the potential to be transformative for the company. If the results are positive in this large phase 3 study in schizophrenia, it paves the way for an FDA submission with the drug available to patients as early as 2026. Following that, Reviva plans to expand its effort to develop brilaroxazine to help millions of people with mental health and inflammatory conditions because of the shared biology between neuropsychiatric and inflammatory diseases. So based on this, we believe this would benefit millions of people who suffer from mental health as well as inflammatory conditions. So the additional indication include in the neuropsychiatric conditions, bipolar, major depressive disorder, and then ADHD. Inflammatory conditions, again, is a large indications with huge unmet need, skin disease, psoriasis, as well as lung diseases, pulmonary arterial hypertension, and then pulmonary fibrosis. So this, we would like to initiate the neuropsychiatric conditions sometime later this year or early next year. So with other conditions next year in 2024.
Dr. Bhatt, it is a true honor and pleasure to see you again. Thank you for coming down to Florida to see us. And most of all, congratulations on getting your drug this far, and best wishes for the future.
Thank you. Thanks for having me.